Hi guys, everyone. If you needed to do a catheter case in your exam, let's quickly go through a few basics about what you might find in terms of the different catheters and types available. So remember, you've got two main different catheter types. Okay, this is a catheter. The shorter one is obviously used in a female. The longer one is used in a male. So if you get two different lengths, two different sizes, make sure you think the longer one is the male, the shorter one is the female. You might get it in a packet. So it's going to come in a packet like this. Notice how this one says for female use only. So if it's a female one, it generally will be pretty clear on why it's a female one. So you don't use a female one in a male and then cause problems of pain when you blow up the balloon. Okay, so let's use the smaller one to show you that. So generally a catheter looks like this. You've got two ports on the end. Okay, so the first port, so when you insert the catheter, the first port is to use to inflate the balloon, and you'll find that the syringe will only fit in one part of that one side. And then when you put the fluid through, you can see that balloon expands. So that keeps the catheter in place. So that's what the first port is for. The second port is to attach to the catheter bag that's going to drain all the urine out. So that will fit quite nicely, as you'll see here, in that port there. So they're designed in a way that's quite clever. You can't get these mixed up, because this will only fit in this port and the syringe will only fit in this port. It's just a nice way to take the pressure of having to remember which side or which color goes with it. For example, it'll only fit in one place. Okay, so two main types of catheter. Longer one is male, shorter one is female. You'll see different thicknesses as well. I mean, I'm not too worried about you remembering all the different types of catheter thickness, but just remember longer is male and shorter is female. Make sure you look at the packet that should tell you it's female only, and make sure you're aware of what the two main ports are. So in the exam, in a case, you're right on top of it, and it looks like you've done it 1,000 times. We cover this in detail in our 2-day SimMan and practical crash course at the Academy. So it's a 2-day course, fully hands-on. 1 day is all about SimMan and emergency scenarios. The next day is all about procedures and examinations. And one of those key procedures that you'll get to practice multiple times is a catheter, because sometimes if you haven't done it on a mannequin, it feels very different to doing it in real life. I hope this helps. We'll see you on the SimMan and practical crash course, or we'll see you at the Academy at some point where you can practice all of this as many times as you like. Have a super day. #CampusMobile.